March 17, 1945, Camp Breckenridge, Kentucky. The surgical scissors gleamed under the operating theater's harsh lights, their polished steel surface reflecting back a distorted image of the room. Sister Maria Hoffman stood motionless at the instrument tray, her fingers hovering inches above the scissors as if the metal itself might burn her. Behind her, Captain David Walsh, an American Army surgeon from Philadelphia, waited with the patience of someone accustomed to teaching nervous medical students. The scissors were German-made, Esculap brand, captured from a Wehrmacht field hospital and now being offered back to a German nurse as working instruments in an American POW camp hospital. Walsh gestured again, his meaning clear despite the language barrier. "Take them. They are yours to use." Maria's hand trembled as she reached forward. Not from cold, though the March morning had been frigid. Not from illness, though she had arrived at the camp 2 months earlier, suffering from malnutrition and exhaustion. She trembled because everything she had been taught about capture, about American soldiers, about what happened to German medical personnel who fell into enemy hands, all of it was being contradicted by this simple gesture. These scissors, emblems of her profession and tools of healing, were being returned to her not as mockery, but as an invitation to resume the work she had trained for years to perform. For 6 months before her capture near the Rhine, Maria had worked in conditions that had reduced nursing to a desperate improvisation, barely recognizable as medicine. She had dressed wounds with newspaper when bandages ran out, had held down screaming soldiers during amputations performed without anesthesia, had watched infection spread because there were no sulfa drugs and no one to treat the dying except more dying. She had been taught that capture by Americans would mean execution or enslavement, that female medical personnel faced particular brutality, that the uniform she wore marked her for revenge. Instead, she stood in a fully equipped surgical theater, holding German instruments, being asked to assist in surgery on German prisoners using techniques and supplies she had not seen since before the war. She lifted the scissors. The weight felt familiar, right? Like returning to herself after a long absence. Captain Walsh nodded approval and turned to the operating table where a German prisoner lay anesthetized, requiring emergency surgery for a ruptured appendix. Maria moved to her position beside the table, and as Walsh made the first incision with steady confidence, she found herself falling into the rhythms of surgical nursing she had learned at Charité Hospital in Berlin a lifetime ago. The American surgeon worked with precision and competence, his hands moving through procedures that followed the same anatomical logic regardless of nationality. He called for instruments using medical Latin that transcended language barriers. He worked to save a German prisoner's life with the same focused intensity that Maria had seen in German surgeons before. The war destroyed everything. As the surgery progressed and Maria's trembling subsided, replaced by the automatic muscle memory of trained practice, she began to understand that something fundamental had shifted in her comprehension of the world. The scissors in her hand were not just surgical instruments, they were keys unlocking questions she had never been permitted to ask, about the nature of her enemy, about the ideology she had served, about what it meant that Americans would equip German nurses to heal German soldiers while American wounded waited for treatment in field hospitals across Europe. The scissors were evidence, material, and undeniable that she had been lied to about nearly everything that mattered. This moment, replicated in variations across American POW camps from 1943 through 1945, marked a profound rupture in the worldview of German medical personnel. For nurses who had served in Wehrmacht hospitals and field units, women trained in one of Europe's most sophisticated medical systems, before watching that system collapse into barbarism and chaos, the experience of American captivity became an education in the stark difference between totalitarian expedience and democratic principle. What they encountered was not merely adequate treatment as defined by Geneva Convention minimums, but something more destabilizing, a systematic professionalism that welcomed their participation in medical work, that provided resources exceeding what German military medicine had seen in years, and that treated them as colleagues rather than captives. To understand the magnitude of this transformation, one must first comprehend the trajectory of German military nursing during the Nazi era and the war years. German nursing had deep professional roots, with training programs that dated to the 19th century and produced highly competent practitioners. The Deutsche Schwesternschaft, the nursing profession's main organization, had been gleichgeschaltet, forcibly coordinated with Nazi ideology in 1933, but the fundamental quality of nursing education had remained high. Women who entered nursing training in the 1930s received rigorous instruction in anatomy, physiology, pharmacology, surgical technique, and patient care that prepared them for demanding professional work. Maria Hoffman had been one of these women, entering nursing school in 1938 at age 18, motivated by a mixture of genuine calling to healing profession and pragmatic recognition that nursing offered women one of the few respected career paths available under National Socialism. Her training at Charité Hospital in Berlin, one of Germany's premier medical institutions, had been technically excellent. She learned sterile technique, medication administration, wound care, and surgical assistance from experienced instructors who maintained professional standards. Even as Nazi ideology increasingly infected the medical profession with racial pseudoscience and eugenic priorities. But by the time Maria completed her training in 1941 and received assignment to a Wehrmacht hospital, German military medicine was already beginning to strain under pressures that would eventually cause systematic collapse. The invasion of the Soviet Union in June 1941 created casualty rates that overwhelmed medical infrastructure designed for more limited conflicts. The brutal winter of 1941-1942 added frostbite and disease to combat wounds, multiplying medical demands while supply lines stretched and fractured. The Eastern Front became a meat grinder, consuming medical personnel alongside combat soldiers as nurses and doctors were killed in bombing raids, died of disease, or simply broke under the relentless stress of treating casualties they lacked resources to save. By 1943, when Maria received transfer from a rear area hospital to a mobile field hospital supporting Wehrmacht forces in the West, the medical system she had trained for had degraded into something barely recognizable. Supplies that had been standard in 1941, morphine, sulfa drugs, sterile bandages, surgical instruments, anesthesia, were increasingly scarce or absent. She learned to improvise with whatever materials could be scrounged to make do with less, to accept that soldiers would die from wounds that proper medical care could have treated. She watched as professional standards she had been taught to maintain became impossible luxuries, as sterile technique gave way to expedient practice, as healing work became triage deciding who might possibly survive with the nothing they had available. The ideological corruption was equally devastating. Nazi racial ideology had systematically poisoned German medicine, and military nursing operated within institutional structures that had normalized violations of medical ethics. Jewish nurses had been purged from the profession. Racial screening determined who received treatment priority. Nurses worked in hospitals that participated in the T4 euthanasia program, that conducted forced sterilizations, that implemented medical protocols designed to serve ideological objectives rather than patient welfare. Even nurses who personally rejected these violations found themselves complicit in a system that had subordinated healing to political and racial agendas. Wehrmacht propaganda had carefully prepared medical personnel for possible capture, with narratives designed to encourage suicidal resistance rather than surrender. Female medical personnel received specific warnings that American and British soldiers would rape and torture captured nurses, that sexual violence awaited any woman who fell into Allied hands, that death was preferable to the degradation and abuse that capture would bring. These warnings built on genuine fears. Sexual violence was a persistent threat that women faced in military contexts, while grossly exaggerating and misrepresenting Allied conduct to serve propaganda purposes. The actual circumstances of Maria's capture illustrated how these expectations shattered against reality. Her field hospital unit was overrun during the Allied advance across the Rhine in March 1945. As American armored units approached, Wehrmacht officers ordered medical personnel to evacuate, but there was nowhere to evacuate to. The front had collapsed, roads were clogged with retreating troops and refugees, and American forces were advancing faster than anyone could retreat. Maria and a dozen other nurses remained with approximately 50 wounded German soldiers who could not be moved, expecting execution or brutalization when American forces arrived. The American soldiers who entered the field hospital were combat engineers, young men in their 20s who had been fighting their way across France and into Germany for months. They secured the facility with professional efficiency, posted guards, and immediately called for medical personnel. Within hours, American medics and doctors arrived, assessed the wounded German soldiers, and began providing treatment. The female nurses were segregated for processing, questioned by intelligence officers, and then, to Maria's profound shock, asked if they were willing to continue nursing work treating German prisoners. The question itself was disorienting. She had expected to be assaulted, imprisoned, perhaps executed. Instead, she was being offered the opportunity to continue her profession. The American medical officer asking the question, speaking through an interpreter, explained that American POW camps housing German prisoners needed medical staff, that German medical personnel would be used to treat their fellow prisoners under American supervision, and that nurses who agreed would be classified as retained persons under Geneva Convention provisions rather than as standard prisoners of war. Maria agreed, motivated partly by professional calling and partly by pragmatic calculation that medical work offered better conditions than general imprisonment. She was transported through processing centers, interviewed multiple times about her service and political affiliations, and eventually assigned to Camp Breckinridge in Kentucky, one of hundreds of POW facilities scattered across the continental United States, housing over 400,000 German prisoners by war's end. The journey took 3 weeks, conducted in conditions that were austere but systematic: regular meals, sanitary facilities, medical attention for the minor respiratory infection she developed, and throughout, an absence of the violence she had been taught to expect. Arrival at Camp Breckinridge introduced Maria to the American camp system's scale and organization. The camp occupied thousands of acres of Kentucky farmland, housed over 3,000 German prisoners at its peak, and included extensive facilities, barracks, mess halls, recreation areas, educational buildings, chapels, and a hospital complex that would become Maria's primary world. The hospital consisted of several buildings arranged around a courtyard, including multiple wards, an operating theater, a laboratory, a pharmacy, and administrative offices. It operated with electrical power, steam heat, running water, and all the basic infrastructure that German field hospitals had lacked for years. The hospital's equipment and supplies communicated messages about American material capacity before any words were spoken. The operating theater had modern surgical lights, proper sterilization equipment, functioning anesthesia apparatus, and surgical instruments of quality steel. The pharmacy stocked medications in quantities that seemed almost obscene to nurses accustomed to desperate scarcity: morphine in standardized dosages, sulfa drugs in bulk, aspirin, sedatives, antiseptics, vitamins. The wards had proper beds with clean linens, bedside tables, adequate space between patients to reduce infection transmission. Supply closets held bandages, gauze, cotton, tape, and all the consumable materials that proper wound care required. Captain David Walsh, the surgeon who would become Maria's primary supervisor, embodied the American military medical culture she would spend months learning to understand. Walsh had trained at the University of Pennsylvania Medical School, practiced surgery at Cook County Hospital in Chicago, and been drafted into military service in 1942. He approached military medicine as a civilian physician, temporarily in uniform, maintaining professional standards and civilian medical ethics despite military context. His supervision of German medical personnel reflected this professional orientation. He treated them as colleagues engaged in shared medical work, evaluated them based on clinical competence rather than nationality, and maintained boundaries appropriate to supervisor-subordinate relationships without the arbitrary cruelty that characterized much German military hierarchy. The first time Walsh handed Maria the surgical scissors on that March morning in the operating theater represented the culmination of 2 weeks of careful integration into the hospital's operations. Maria had initially been assigned to basic ward nursing, checking vital signs, administering medications, changing bandages, while American medical staff evaluated her competence and reliability. She had worked under close supervision, her every action monitored, her clinical decisions subject to review. But as her skill became evident, as she demonstrated mastery of techniques and knowledge of procedures, the level of autonomy increased. The scissors represented trust, conditional and monitored but genuine nonetheless. By offering them to Maria, by inviting her to assist in surgery, Walsh was acknowledging her professional competence and incorporating her into the medical team as a functional colleague rather than merely supervised labor. The gesture required him to trust that she would use the instruments properly, that her training and professional identity would override any impulse to sabotage or resist, that her commitment to healing would transcend her status as enemy captive. For Maria, accepting the scissors meant entering into a relationship with complexity that she had not anticipated. She was assisting in surgery on a German prisoner, using German instruments supervised by an American doctor, in an American facility. Her professional identity as a nurse demanded that she perform competently, that she prioritize patient welfare, that she maintain the clinical standards she had been trained to uphold. But doing so required her to cooperate with American military authority, to function as a component of the enemy's medical system, to help German prisoners survive in American captivity rather than returning to German military service. The surgery progressed smoothly, the appendectomy completed without complications, the patient stable and recovering. As Walsh sutured the incision with neat, precise stitches, he spoke to Maria in simple English, explaining his technique and reasoning. She understood perhaps one word in 5, but the tone conveyed respect. The manner suggested he viewed her as someone capable of learning and understanding rather than merely following orders. When the surgery concluded, he thanked her, with a formality that seemed strange given that she was a prisoner, and he could have simply commanded her work. The patient, a 22-year-old Wehrmacht infantryman named Klaus Weber, recovered fully from the appendectomy thanks to the surgery and the antibiotics administered post-operatively. In a German field hospital in 1945, his appendicitis likely would have ruptured before surgery was possible. The resulting peritonitis would have killed him in agony, and his body would have been buried in a mass grave if time permitted or left to rot if it did not. Instead, he survived, healed, and returned to the general prisoner population within 2 weeks. His survival represented the material reality of American medical capacity, the antibiotics that prevented infection, the anesthesia that allowed surgery, the surgical skill that Walsh possessed, the nursing care that Maria and others provided, all enabled by systematic resource allocation that treated prisoner welfare as legitimate institutional priority. The scissors became Maria's constant companions over the following months as she participated in dozens of surgical procedures. They were tools of her trade, instruments that connected her to her professional identity and to the pre-war world where medicine had been a healing profession rather than desperate improvisation amid collapse. Each time she picked them up, she experienced the same slight tremor of cognitive dissonance. These were German instruments, being used to heal German patients, but within an American institutional framework that provided resources and maintained standards that German military medicine could no longer achieve. The symbolism of the scissors extended beyond their practical function. They represented precision, the careful, controlled cutting that distinguished surgery from butchery. They embodied professional standards that required proper tools properly maintained. They connected Maria to a tradition of medical practice that transcended nationalism, that followed anatomical truths and physiological realities that were the same regardless of which flag flew outside the operating theater. The scissors were evidence that American military culture recognized the value of professional medical practice, that it allocated resources to maintain standards even for enemy prisoners, and that it understood medicine as universal profession with principles that persisted across political boundaries. Other German nurses at Camp Breckinridge underwent similar experiences of professional reintegration under American supervision. Sister Elizabeth Braun, a more experienced nurse who had worked in Wehrmacht hospitals since 1939, initially refused to cooperate with American medical staff, viewing such cooperation as betrayal of Germany. She changed her assessment after witnessing the quality of medical care provided to German prisoners, after recognizing that her refusal to work meant other prisoners received less competent care, and after Captain Walsh patiently explained through an interpreter that nursing ethics demanded she provide care regardless of political circumstances. Braun's transformation from resistance to cooperation illustrated how professional identity could transcend national loyalty when material conditions made the superiority of one system undeniable. The medications in the hospital pharmacy carried their own revelatory weight. The morphine, packaged in standardized glass ampules with printed labels, represented the difference between humane and barbaric medicine. Maria had watched German soldiers die screaming from wounds that morphine would have eased, had held their hands as they thrashed in agony from pain that exceeded human tolerance, had learned to close her ears to sounds that would otherwise drive her mad. The casual availability of morphine in American camps, where it could be dispensed according to medical judgment without tortured calculations about impossible scarcity, communicated that American medical logistics functioned at levels German medicine had not achieved even before the war's disruptions. The penicillin vials particularly astonished German medical personnel. By 1945, German nurses had heard of penicillin through captured medical journals and prisoner interrogations, knew theoretically what it could accomplish, but had never seen it used. American pharmaceutical production of penicillin represented industrial achievement that German science had understood, but German industry could not replicate at scale. The antibiotics availability in American POW camps, where it was used to treat prisoner infections that would otherwise be fatal, revealed industrial and organizational capacity that propaganda had consistently denied. Maria used penicillin to treat German prisoners with infections that would have meant death sentences in Wehrmacht hospitals. Each successful treatment, a wound infection that cleared after antibiotic therapy, a pneumonia that resolved with treatment, a sepsis that reversed before reaching fatal stages, accumulated as evidence challenging her understanding of the war and the nations fighting it. If Americans could produce revolutionary antibiotics in such quantities that even enemy prisoners received them, while German soldiers died from treatable infections, what did that reveal about the relative industrial sophistication of the two societies? If American military doctrine mandated providing cutting-edge medicine to captives, while Wehrmacht medical services had collapsed into inadequacy for their own soldiers, what did that reveal about the two systems' fundamental priorities and competencies? The relationship between German nurses and American medical personnel evolved through daily interaction and shared professional work. Language barriers initially complicated communication, but medical terminology provided a shared vocabulary, Latin anatomical terms, pharmacological names, procedural descriptions that were similar in German and English. German nurses learned basic English medical phrases. American doctors picked up essential German medical vocabulary, and interpreters facilitated more complex discussions. Gradually, a working professional culture developed that transcended linguistic limitations and national enmities. Captain Walsh's approach to supervising German nurses combined professional respect with clear hierarchical authority. He conducted regular training sessions where he taught American surgical techniques, demonstrated new procedures, and explained the pharmacological reasoning behind treatment protocols. He encouraged questions, valued clinical observations regardless of source, and acknowledged when German nurses had expertise or experience in areas where his own knowledge was limited. He maintained professional boundaries appropriate to supervisor-subordinate relationships and never forgot that these were enemy nationals requiring security oversight. But within those parameters, he treated German medical personnel as colleagues rather than captives. This professional respect extended to working conditions that acknowledged nurses' dignity and needs. German nurses worked 8-hour shifts with breaks for meals, had access to adequate housing and sanitation, received uniforms and footwear appropriate for medical work, and were provided with the materials and equipment necessary to perform their duties competently. These conditions reflected American institutional culture's assumption that workers, even prisoner workers, functioned better when basic needs were met and when work environments were organized rationally rather than punitively. The contrast with German military culture could not have been more stark. Wehrmacht organization had emphasized duty and sacrifice, had treated subordinates as instruments to be used rather than human beings whose welfare mattered, and had maintained discipline through a combination of ideological indoctrination and brutal punishment. German nurses had worked impossible hours under horrible conditions, had been expected to function despite exhaustion and inadequate support, and had seen colleagues break under pressures that institutions ignored. American willingness to provide adequate rest, proper equipment, and systematic support communicated institutional priorities that valued effectiveness over performative toughness. The surgical procedures Maria assisted with became spaces where professional medicine's universality was most visible. When Walsh performed surgery to repair a shattered femur in a German prisoner injured in the camp's woodworking shop, the procedure followed the same orthopedic principles that German surgeons would have applied. The anatomy was identical, the physiological responses were the same, the surgical techniques transcended national boundaries because they reflected biological realities rather than political ideologies. In the operating theater, German and American medical personnel collaborated to solve clinical problems using shared professional knowledge, and in those moments national identity receded while professional identity dominated. Maria found herself experiencing cognitive dissonance with increasing frequency as her time in the camp extended. She was performing competent nursing work, was helping German prisoners survive and recover from injuries and illnesses, was maintaining professional standards and taking pride in work well done. But doing so required cooperation with American military authority, participation in an enemy institution, and daily exposure to evidence that challenged everything she had been taught about American society and the war's meaning. News of concentration camp liberations reached Camp Breckinridge in spring 1945. American authorities required German prisoners and retained personnel to view documentary footage and photographs from Dachau, Bergen-Belsen, and other liberated camps. The images, skeletal survivors, mass graves, gas chambers, medical experimentation facilities, devastated German medical personnel who had to confront their profession's systematic corruption into instruments of genocide. For nurses who had maintained that their medical work was apolitical, that they had served healing rather than ideology, the concentration camp evidence was particularly shattering because it revealed medicine's central role in implementing racial murder. Maria watched the footage in silence, feeling her professional identity fracture as she recognized medical facilities in the photographs, understood the systematic nature of medical complicity, and had to acknowledge that German nursing had operated within and supported an institutional framework capable of such evil. She had not worked in concentration camps, had not participated directly in medical killing, but she had served the same regime, had worn German medical uniforms, and had helped sustain a military fighting to defend a government that built industrial murder facilities staffed by doctors and nurses. Captain Walsh handled this period with a combination of moral clarity and professional consideration. He did not accuse individual German nurses of war crimes without evidence, did not hold all German medical personnel collectively guilty for concentration camp medicine, but he also did not excuse or minimize German medicine's systematic corruption. He spoke about medical ethics as non-negotiable professional obligations, about the Hippocratic tradition that demanded physicians and nurses resist political pressures that would corrupt healing professions, and about the responsibility medical personnel bore for the institutional systems they served. These discussions, conducted through interpreters and in Walsh's halting German, planted seeds for post-war reconstruction of German nursing. Maria began to recognize that German medicine would require fundamental reformation, that professional standards needed institutional protections against political corruption, and that medical personnel bore responsibility for ensuring their profession served health rather than ideology. The fair treatment she received from Americans, the professional respect Walsh demonstrated, the systematic maintenance of medical ethics, even in POW camps, all provided models for what reconstructed German medical institutions might aspire to become. Germany's surrender on May 8, 1945, created psychological crisis among German prisoners and retained personnel. The total defeat contradicted years of propaganda promising ultimate victory, revealed the extent of lies they had been told, and forced recognition that sacrifices made had served a cause both evil and doomed. For Maria, the surrender meant confronting that she had served a criminal regime, that her medical work had sustained military forces fighting for genocidal objectives, and that her professional competence had been deployed in service of unprecedented evil. American camp administrators managed this period systematically, providing information about surrender terms, occupation plans, and democratic reforms that Allied authorities intended to implement in occupied Germany. They organized educational programs designed to break down Nazi ideological indoctrination and introduce democratic values. They showed documentary evidence of German war crimes, explained international law governing occupation, and prepared prisoners for eventual return to a Germany that would be fundamentally transformed. Maria's repatriation came in summer 1946 as part of a group of medical personnel being sent to the American occupation zone to address public health crises. She traveled by ship to Bremerhaven, then to assignment in a hospital in Bavaria. The Germany she returned to was devastated, cities in ruins, infrastructure destroyed, economy collapsed, population traumatized. But she brought more than nursing skills back to this broken landscape. She brought experience of functional medical institutions, of systematic resource allocation supporting healthcare, of professional practices maintained according to ethical standards, and of a society organized on principles that prioritized human welfare over ideological objectives. The scissors that Captain Walsh had handed her on that March morning remained in her memory as a symbol of everything that had transformed during her captivity. They represented precision and professionalism, the careful, controlled work of healing rather than the desperate improvisation of collapse. They embodied the trust that professional identity could transcend national enmity, that competence deserved recognition regardless of political circumstances, and that medicine constituted a shared human enterprise with universal standards and obligations. In post-war years, as Maria worked to rebuild German nursing and train new generations of nurses committed to ethical practice, she often thought of those surgical scissors and what they had taught her. They had taught that material abundance enabled humane treatment, that institutional competence required systematic resource allocation, and that societies organized around democratic principles could achieve both prosperity and power without requiring totalitarian control. They had taught that professional respect was possible across lines of enmity, that defeated enemies could become partners in reconstruction, and that individuals bore responsibility for the institutions they served and the ideologies they enabled. The trembling in her hands when she first reached for those scissors had been the trembling of a worldview collapsing, of certainties dissolving, of recognition that she had been catastrophically wrong about nearly everything that mattered. The steadiness that had replaced that trembling as she worked alongside American medical personnel represented not just physical adaptation, but psychological transformation, from propaganda-fed nationalism to recognition of universal human dignity, from racial ideology to professional ethics transcending nationality, from faith in authoritarian hierarchy to understanding of how democratic institutions could function effectively while respecting individual worth. As West Germany emerged as a democratic state and Atlantic ally, as German nursing rebuilt international reputation on ethical foundations, the experiences of nurses like Maria Hoffman contributed to broader reconciliation between former enemies. The fair treatment German medical personnel had received, the surgical scissors and antibiotics, the professional respect and systematic support, the opportunity to practice healing profession competently despite captivity, demonstrated that American power included restraint, that victory did not require cruelty, and that former enemies could recognize shared values and build common institutions. The surgical scissors in Maria's hands had cut more than tissue during those surgeries in Kentucky's Camp Hospital. They had cut through propaganda's lies, through ideological certainties that collapsed against material evidence, through the psychological armor that protected people from recognizing they had served evil. And in that cutting, painful as it was, lay the possibility of healing, not just of individual patients' wounds, but of a nation's moral injuries, of a profession's corruption, and of a woman's understanding of what principles deserved loyalty and what institutions deserved trust. The March light streaming through the operating theater's windows, the gleam of surgical steel, the steady rhythm of professional medical work, these became touchstones in Maria's memory, representing the moment when her transformation began, when she started the difficult journey from Nazi indoctrination to democratic values, from nationalist certainty to recognition of universal human dignity. The scissors had been handed to her by an enemy who chose to see her as a colleague, who trusted her competence despite her captivity, who demonstrated through countless small professional courtesies that humanity could survive even total war, that medical ethics could persist across political divides, and that the careful, controlled cutting of surgery could symbolize both the precision required to heal wounds and the difficult work of cutting away ideological poisons that had infected an entire society. In the end, the trembling German nurses experienced when American doctors handed them surgical tools revealed something fundamental about the nature of power and principle, about the relationship between material abundance and institutional values, about how societies organized around different principles produced different outcomes. The trembling marked recognition that everything they had been taught was wrong, that their enemies possessed not just superior material resources, but functional institutional cultures that enabled both military victory and humane treatment of defeated foes. And in that recognition, painful and disorienting as it was, lay the foundation for transformation, personal, professional, and ultimately national, that would shape the post-war world and the reconciliation of former enemies into democratic allies united by shared values and common institutions.